So I would like to start with this quote. So it is said by uh, Satya Nadella, CEO of Microsoft. Microsoft, we all know that giant in IT infrastructure, and he said that the greatest achievement of technology is not how it changes life, but how it improves it. So that is very much important. That technology has just not change our life, like it has to improve, as he clearly mentioned that. So I know that it will be very much difficult having a post lunch session, that to have a good lunch. So I don't want to take much time, just 10 minutes I'll complete my presentation, and I take this opportunity to thank DPH sir and DPH officials and the scientific committee for providing this opportunity to me. So since morning, we have seen that all the senior uh, officials are here, and they are presenting their data and epidemiology and health financing, lot of things. And when it comes to technology, you can see some junior colleagues like me, and there was another presentation happened, Aishman Bharat Digital Mission. So you can see some young faces in this presentation, because this technology is new to this entire ecosystem. So we are learning this technology, things are here. But though this technology is young, but this technology is very smart. This technology is learning from past and planning for the future. So my topic here is like leveraging the health tools for strengthening health systems, particularly in Tamil Nadu. So, so first of all, we would like to see how this health is evaluation is happening. So 100 years back, so when we want to take a treatment, we have to travel. We have to travel certain place, and otherwise the medical fraternity has to come to the patients and have to treat the ailments or the patients. So later what happened, some technology came in, and we no need to travel. Somewhere we can be there, and we easily connect with the medical fraternity, and we got the treatment, and the knowledge also shared over technology. So everything was smooth, and whatever technology available, 2G, 3G, 5G, smartphones, so whatever is coming up one by one, we are just using these things, and everything slowly phased manner it was moving. But suddenly what happened, everything stranded, everything stopped. We are clueless what to do, how to move forward, because of this one virus called corona. So everything stopped. We whatever the digital things we have, that is not enough to communicate or to disseminate the knowledge what we have, or to treat the needy people. So now totally the globe is changed. Earlier we used to mention before Christ, BC and AD. So now totally it is BC and AC, means after corona and before corona. So a lot of things have changed. So how the future is going to be is like this. So we have to coexist with the technology. So whatever technology may be, it may be AI, it may be a robotics, or it any other form of technology, we have to coexist. So when I say coexist, it is not to one layer, it has to penetrate the deep down. From the medical officers to ASA level workers, VHNs, they all have to learn technology. So without technology, it will be very difficult in the future. So what is digital health? So this is the digital health. So any digital equipments, from the smartphone to computers, laptop, whatever, even our wearables now, smart watches are there, smart rings are coming up, smart specs are coming up, anything that helps to leverage the health. So that is all called digital health. So digital health. So I just want to share some of the points about global trends, how it is. So there was a market analysis report is saying there is a huge market for the global health. If you see that 2024 prediction is 288 US billion. It is not only from the private sector, it is kind of both private as well as the government side. So, and they are projecting that it will be go high in 2030. If you see, it is going to be touch billions of dollars, and it is the compound growth of 22% over the years. And currently, this North America is very prominent in their digital health market. So what happened in the 73rd World Health Assembly, they also endorsed the global strategy for the digital health, how we have to go into that. And they're saying that digital health definitely will enhance and complement the work, whatever we are doing it and whatever we are going to do. So that is the future health networks also. So digital health will enhance the efficiency. Definitely it is going to be enhance our efficiency, sustainability of the health systems, and delivering a quality service and affordability also. So they're saying that it definitely strengthens the health promotion. Definitely it will help us to prevent the diseases and management, and especially the rehabilitation components and into the palliative also. So, and they're saying that digital health can improve efficiency and cost effectiveness of care, allowing for new business models. So that in upcoming slides we can see how it will be the delivery of services. So another report of Deloitte, they have recently conducted a research in Western and European countries, and they have come up with the reports like their Deloitte Center for Health Solutions, and they are saying that in 2025, the digital means this year, the digital transformation impact is going to be very much high. And they are saying that many health systems still they are relying to the old way of approach, and they are saying that they have to move into the new era. And they have identified the many countries a decade ago they have moved into new they have adopted the health systems, digital systems, and some of the countries are very advanced. They have started using AI, emotional intelligence and everything into their system, and some of the countries slowly coming into the system. So this is the graph how this market is going to be boom. So in another 10 years, so there is a lot of investments are coming in startups and existing technological company. Everything is like another 10 years the market is going to be very high. And this is the Indian trend. It is not only global, it is in India, in our country. So we are also like growing up. In another 10 years the market is like 106 billion US dollars. Okay, so this growth is exponentially coming up. Here, are we ready to take it into action? So, if you see, the action is not what already is booming up, especially if you see the workforce. So, workforce is like there is a lot of challenges are there. So, there is a shortage is there is upskilling is there. So, there is like action, the need is 80%, but the action taken is 67%. I think this morning also the first panel discussion, there was a question came up like how to train the healthcare professionals in the ground level, how can private partnership can engage with the training digital technology. So that question will be answered in this session, because I'm going to tell how an organization collaborate with the DPH and doing the capacity building of healthcare workers, since that is the very major point and it is need of the hour. 88% of workforce needed retraining or capacity building, and only we are equipped with 67% currently we are into that position. Okay, so I think we are all know that what India have taken steps for the digital mission. Yeah, so Ayushman Bharat, we have the detailed session, and we had UWIN, we had CoWIN, Telemanas of everything. And there are some private partners also into the market. They are also providing lot of health technologies in the even in mobile wearables and all those things. So when it comes to a digital, it is a major thing. It is very much important is governance, because in digital everything in the air. We don't know who is taking what. Data privacy and data is very much important. And globally, even WHO also saying that it should be ethically. We have to create the governance system. If you see Europe Union, they have their GDPR law to protect the data, and US HIPAA compliance is there. And like in US also, beyond the HIPAA compliances, they have the means state-wise law, that is one Washington's My Health My Data Act, which is covered, which is not into the HIPAA compliance. And whereas India also into it. So recently the Digital Personal and Data Protection Act 2023 is going to be come up. And it is the major highlight in that it is any data violation, any data breach is happened, then the fine is going to be huge. Even if it is done by an individual, the fine is going, the penalty is going to be in crores. So this is the digital governance what India is planning to do. And the last is DISA, this digital information security in healthcare. It is now in public opinion, and once it will be rolled out very soon. So we know that Tamil Nadu is pioneering using in data and means digital things. And so in that lot of things we know that Makkalai Thedi Marthuvam, in last session also we discussed in detail Makkalai Thedi Marthuvam, our pygmy system and everything. Along with that, in 2018 DPH graciously accepted our proposal from Eco India using this Eco platform for the capacity building. So I belong to this organization called Eco India. It's based out of a Delhi non-profit organization, providing a digital platform for capacity building and training for the healthcare workers. Healthcare workers means not in the first layer, and it is into the last mile of healthcare workers, including VHNs and ASAs. So this model of capacity building is very replicable model. It is having hub and spokes model, and we are using ABCD model, amplifying the technology with the best case-based practice and data-based evidence. And this is the papers published used by the ECHO model because of the capacity building. So this is there are regularly we are doing our classical training, where we invite the people and we have the training and whatever modules we are going to do that. Along with that, now this ECHO model also is there, so we can do a hybrid model of training. There are both plus and minuses are there for the online training and that classical mode of training. So Echo model is very much easily replicability in anywhere you can use it. You just take a laptop and a smartphone is enough to connect with the people for this training. So we use the digital infrastructure called iEcho. iEcho is developed by Echo India and for the video conferencing. So you can use it. It is a web-based, app-based application. So it is easily replicable. Anybody can, smartphone is enough to download this app and then you can use this platform. So it is very much scalability, and there is no geographical barriers for this. Anywhere you can connect with the resource person across India. You can sit to one place and connect globally easily. So what we have done so far in Tamil Nadu is we have implemented 5 major projects based on the state's need. So first program is for the cardiometabolic syndrome. We have selected 5 states, 250 medical officers, and the training is ongoing. We have completed 100 medical officers. The third batch is going on. And the CPHC is very much important program, comprehensive primary healthcare training for the healthcare workers like ASHAs, means ANMs and VHNs. We are training. Two phase of CPHC training we have done. First phase in Kallakurichi, second phase is in Madurai, and third phase is going to be come again in Kallakurichi. So again we are going to take 500 frontline workers. So we are going to take that. And Cancer Care Bharat project is a 6-year ongoing project where we are training the medical officer under the family care. So it is a new concept for the medical officers, because usually we are in diagnosing and treatment, and this is the training we are giving along with the Cancer Institute Adayar. So how to cater the family needs when they are undergoing a terminal ill. So yeah, sorry. This is a women's health program. Again, we have focused on women's health. So we have completed this training program. So all the training is virtual mode, and we have reached to the ground level. And they are our board of trustees, backbone of our organization. They are helping us to move forward. Thank you.